If you're lying awake at 2 a.m. thinking, I've tried everything, so why am I not sleeping? This is for you. You've probably tried the usual things: magnesium, melatonin, better routines, maybe even prescriptions or therapy. And you're still wide awake or waking up at the same time every night without a reason why. That's usually the point where it starts to feel both confusing and frustrating. Because if this were just a simple sleep problem, one of those things probably would have worked by now. I'm Dr. Kinney, an IFM certified functional medicine practitioner, and insomnia is actually what pulled me into this field to start. First as a patient, now as a practitioner. So instead of seeking out another quick fix, let's slow down and actually dive into what persistent insomnia might actually be pointing to underneath, and why those usual approaches sometimes miss the mark. To understand this, it helps to look at how sleep actually works in the first place. Sleep doesn't just happen because you're tired. It depends on two conditions lining up at the exact same time. The first is your sleep rhythm, your internal clock that tells your body when to expect sleep and when to expect being wide awake. The second is a concept known as sleep pressure. This is the buildup of the need for sleep the longer that you stay awake. A simple way to think about this is to consider your hunger cues throughout the day. You can feel hungry around the same time every day because your body expects food at certain times based on these deeply ingrained rhythms. But if you haven't eaten all day, you can feel extremely hungry at a time that you normally wouldn't. Sleep works much the same way. You need enough pressure to feel sleepy, and you need that pressure to line up with the timing your body expects it to be sleeping. If those two don't align fundamentally, that's where you can feel tired and still not be able to fall asleep, the tired but wired feeling. A 2022 systematic review goes over this exact concept on sleep regulation, and it describes what's called the two-process model. It shows that sleep depends on both the buildup of the sleep pressure as well as your internal circadian rhythm. In other words, simply being tired isn't enough if your timing is off when it comes to circadian rhythms. And if you're one who likes the research, I've included a free research summary. It's in the pinned comment and the description below. Easy to digest, and you can get your eyes on the evidence yourself. So rather than focusing on sleep itself, it helps to look at what might be shifting these conditions. And to make sense of this, we're going to zoom out. Most of the things that influence sleep fall into one of two broad categories. The first is environmental: your schedule, your stress, your light exposure, how consistent your daily patterns are. These are the environmental factors that influence sleep. And the second is internal. This is how your body is regulating things like hormones and blood sugar and your overall nervous system activity. This distinction between environmental and internal gives you a starting point. You can begin to ask whether the issue is being driven more by what's happening around you or what's happening inside you. But in reality, these issues don't stay separate for long. What's happening in your environment generally starts to shape what's happening internally in your chemistry. And what's happening internally changes how well your system responds to your environment as well. So the two are deeply interconnected. So instead of thinking of insomnia as one isolated issue or disease state entity, it's more accurate to see it as a mismatch, being influenced from both directions at the same time. This is where the patterns that many of my patients experience start to make more sense. Many people feel particularly tired during the day, but more alert at night, kind of a flip-flop of the circadian rhythm expectations. You might get into bed and your mind just turns on and lights up and ruminates. Or you fall asleep fine, but you wake up at the same time every night and can't get back to sleep easily. At a surface level, it can feel random and obviously incredibly frustrating. I've been there. But underneath that, what's usually happening is a mismatch, again, between your sleep timing and your sleep pressure. One of the biggest reasons for that mismatch is something that we don't often think about as humans. Humans are one of the only species that can consciously and voluntarily override their signals to sleep. If you watch a dog or a cat in the evening, you know what I mean. Once their system starts to wind down, they go partially catatonic, it seems, and they follow their cues directly. But we have the ability to push past that natural signal. We stay up, we keep working, we're doom scrolling, we're watching TV, basically stimulating ourselves ultimately, and move past that window where sleep would have come on a lot more naturally. Over time, that starts to shift your rhythm. And when your rhythm shifts, your sleep pressure doesn't always line up with that anymore. So you end up tired, just not at the right time. And I want to speak to a broader cultural layer in this as well. Functioning on less sleep is often seen as productive or sometimes a badge of honor. But over time, that can blunt your sensitivity to your natural rhythms. And this involves many downstream systems, including your stress hormones and your sex hormones, and even your immune system resilience. You may feel like you're managing and getting ahead, but underneath that, your system is adapting to a setup that's no longer aligned with your natural rhythms. Our systems have an amazing ability to adapt, but when it's moving in the wrong direction, that's what can have that compounding effect over time. This is where the cycle starts to get incredibly frustrating. Once your sleep becomes inconsistent, most people try to fix it directly and force the system to behave. They add the supplements or the medications, they try to wind down earlier and do all the sleep hygiene habits. Some of these tools can help in certain situations, but if the underlying issue is that the rhythm and the pressure aren't aligned, those approaches don't always address that directly. They can make you feel more relaxed. They can make you feel more tired even, but they don't necessarily change when your body expects to sleep and how much sleep pressure has actually built up throughout your day. So the effort is increasing, but the timing and the conditions actually haven't shifted. And that's where the loop happens. You can try to force sleep, but the system isn't set up to actually let it happen naturally. And that's why it can feel like you have tried everything and nothing's working. There are a few common factors that tend to disrupt your sleep rhythm and pressure, and most of them extend beyond the act of sleep itself. One of the biggest is stress and stress chemistry. When your system is in a more activated state, both your nervous system and your hormones respond accordingly. This makes it harder to fully transition into a sleep state, even if you are physically tired or mentally tired and exhausted. That activation can also shift your internal timing, especially when it becomes a consistent pattern in your life. Another issue that comes up is inconsistency in your daily patterns. If your sleep and wake times vary day to day, even between weekdays and weekends, or your exposure to light during the day or first thing in the morning, and activity changes day to day, your rhythm has a harder time stabilizing. When timing becomes less predictable, sleep tends to follow that as well. It's particularly sensitive. And in the fad world right now of intermittent fasting, this is another thing that can disrupt your rhythms throughout the day. When we eat is another signal that stabilizes even our sleep rhythms. Then there's a particular sneaky type of stress that comes in, and that is overstimulation, especially later in the day after about 2 p.m. Screens, work stress that bleeds into the evening, or ongoing mental load. These keep the systems engaged at a time when it would normally be starting to wind down. A lot of people will feel tired at night because of the energy expenditure, both mental and physical, but their systems never actually get that clean transition into sleep. It just carries the day into the night. None of these factors that affect sleep and sleep pressure act in isolation. They layer together over time, gradually shifting both the timing and the pressure in a way that makes sleep feel less and less reliable. When these factors start interacting with one another as well, this just further adds to the complexity fire. This is where insomnia truly begins to feel inconsistent, and tranquilizers may feel like the only option at this point. Builds gradually. That's what I want you to hear. Stress increases the overall demand on your system. That starts to affect how well your recovery occurs at night. And when recovery is incomplete, your sleep pressure also doesn't build the same way the next day. And when the pressure is lower, the timing becomes more sensitive. Now layer in the inconsistency that's understandable along this process. The different sleep times, different wake times, different levels of stimulation day to day. And at that point, rhythm and pressure aren't just slightly off. They're no longer coordinated and communicating with each other. Some nights you fall asleep, others you don't, others you rely on the external tools, and it feels like there's no clear reason why or pattern. This is exactly where a functional medicine systems-based approach starts to look at the way these things are all connected. Your system is responding to a sequence of inputs across your body systems. It's just harder to see that, of course, when you're living it and in the middle of it. If you've tried the different approaches and made the adjustments to your sleep hygiene and the tools you're using, you may have even gone down the pathway of looking at some basic conventional labs, but everything comes back normal or within range. But the experience hasn't changed. When you do look a little closer through this systems-based lens, there are usually a few consistent patterns that come up objectively. Maybe you can boil it down to one of these two areas. One is difficulty falling asleep. You get into bed, and instead of winding down, your systems become more alert and your mind is racing. Another is difficulty staying asleep. You fall asleep fine, but you wake up at a consistent time or window and can't get back to sleep. And then there's also the feeling of not being well rested in the mornings, even when you get 7 to 9 hours of sleep. You technically slept, but you're not feeling it. Each one of these tends to mean something different going on underneath in the chemistry and in your rhythms. And with advanced functional labs, we can get insight into this. It's a much different perspective than any cortisol conventional testing you've done before. If falling asleep is the issue, it often reflects a delay in rhythm or a system that is still too activated at night. If staying asleep is the issue, it often reflects something disrupting your continuity, usually subtle stress patterns or maybe blood sugar imbalance as well that may not show up on conventional testing. A 2025 systematic review found that poorer sleep quality was associated with more unstable blood sugar regulation patterns. This helps to explain why some people wake during the middle of the night, often between that 1 to 4 a.m. window, without a clear external cause. If you've been told nothing is happening, that's likely not the case. It's that the signals are subtle, and they often start to make sense when you look at how these pieces line up together and look at the patterns and the systems involved. For a lot of my patients, this is the point where things stop feeling random, where they can see their chemistry objectively on a piece of paper and say, oh, that's why I feel what I feel. Once you start to see insomnia in this way, it naturally raises another question in many people's minds, because the issue isn't just sleep itself. It's what your system is doing underneath the surface to coordinate sleep, to shape your energy and your recovery. This video here on screen walks you through that next layer and how these patterns can exist when everything else looks normal on paper. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next one.